And welcome back. Well, even though rosacea is a very common problem, it can be frustrating if you've tried to control it or cover it up. You know, it just keeps on coming.
Yeah, today we're going to tell you about a new treatment that's proven to work, and the best part is you can get rid of the redness and have beautiful glowing skin too. Dr. Deborah Manjoney is the medical director and owner of the Wisconsin Vein Center and MediSpa. I want to talk about rosacea because I've tried to explain it to people. It's like some things, you manage it.
That's right.
Some people, I think, just try to cover it up, and I've been there. But if you really try to treat it, it's so much better.
Well, it is. And rosacea is a difficult problem. It affects a lot of people, especially women over the age of 30 is when it first starts to come out in most people. And there are different degrees of the severity of rosacea. It can be just a little pinkness or redness in the skin that can then become vessels that are there permanently that you might want to get rid of, and there are ways we can do that. But it can also have, you know, really an acne look. You can have little papules and pustules involved on the skin.
What is it?
That's a very difficult thing to explain what it is.
Okay.
It is some kind of dysfunction between the nerves and the vessels in the skin. So sometimes the vessels are just closer to the surface of the skin in certain people, and then there is just a compromise in how the neurovascular response is to different stimuli. So one of the things to do is to figure out what causes you to get redder.
Well, that's what I was going to say, because I feel I only get it on one cheek. It's just my right cheek, and it does. It almost looks like a little acne-esque, but I find it gets inflamed. It first got inflamed when I used to drink beer, beer or wheat or things like that. But that would set it off.
Heat is another really important thing. Although, you know, we really can't say that certain things make it worse. We do know that some people feel that spicy foods or wine trigger it more. We definitely know that temperature does, and wind. So if you're out in the hot sun, it can make it worse. If you're in a cold situation where there's a lot of wind, it can make it worse. So flushing may be something you even have in childhood, and as you get older, it becomes more and more common that you're getting it, and then it can become permanent.
Is it normal, like, you know, that you would get it in one spot and not?
Well, usually it's in the mid portion of the face, the forehead, nose, and around the cheeks. And you know, there are a lot of different theories about the cause of rosacea, and some of it is immune, some of it is genetic, that there are certain people who are going to be more likely, Northern European extraction especially, very fair-skinned people. And then there are definitely findings that the people who have rosacea seem to have more of what's a normal little mite living in our skin, that they have more of them. So whether or not that's causing more problems, we don't know, but that may be related to some of the more severe cases of rosacea.
We got bugs.
Yeah.
Well, everyone does. Everyone does.
Everyone does.
We all have these microscopic things on their skin.
Talk about, because I want to talk. Yeah, I know it does. Like, I want to talk about my own personal experience with AFT, but I wanted you to talk about the treatment first.
Sure. So treatments that, you know, first of all, we want to try to make sure everybody's using things that aren't sensitizing, because the treatment of rosacea first starts with getting rid of the things that may be abrasive, that may be harsh on your skin, because rosacea is a sensitivity.
Like a scrub or
like
things
a scrub.
like that?
It's not the kind of thing you want to use when you have rosacea. And that's hard, I think, when people have acne rosacea. They've gotten to that point, they think they've really got to scrub their skin. No, that's making it worse.
Yeah.
So a very gentle cleanser, just using your fingertips to clean your skin, those are important things. And those are things that we need to talk to people about. But then the treatments that we offer to really get rid of redness include AFT, which is intense pulse light, our advanced fluorescent technology that we use, which is the AFT abbreviation, works very, very well to control the redness. So it usually takes 3 to 4 treatments about a month apart, and this is using multi-spectrum light that's going to be able to really be attracted by that redness. The vessels absorb it. The vessels actually get closed off because of the laser, and the light that we're emitting. And then eventually the skin just gets to look a lot more beautiful, because intense pulse light also makes the skin look more luminous, healthier, helps to minimize pores and things like that.
That's the thing I wanted to say about the treatment, is that it takes care of rosacea. I feel like if I do just twice a year, so I usually do it before we get really into summer, and then, you know, fall going into winter, because you don't want to be in the sun after you have it.
That's exactly
but the thing is, after I have this treatment, people are always like, what did you do to your face? Did you have Botox? Did you do something like that? Because I think it really refreshes up your skin.
I do too. Often people don't see it with just one treatment, but if they've had a series of 3 and then they come back for maintenance, they're going to continue having that nice lustrous look.
Yeah, because it closes off. I had blood vessels that were sort of exposed on the nose, on the cheek, just like you said, and it sort of closes those, but it also has sort of a it brings out glowing skin.
Yes,
sort
it
of
does.
Like.
And it's
and you don't have to wear makeup as
It's
much.
a rejuvenating treatment, because we do know now, with all the number of years that intense pulse light treatments for photofacial rejuvenation have been being done, that the person who invented this back in the 90s looks younger today than he did back then. His skin still looks like he's 30 years old.
Oh my gosh, I want to Google that.
Yeah.
What's his name?
Dr. Patrick Bitter.
Dr. Patrick Bitter.
Yeah.
Okay, that's cool, because I think one of those things, when you see something like that, that's like, people are like, okay, I'm doing that.
So it does build collagen. It does, you know, if you really do regular treatments, it's really very important for the health of your skin.
Molly looks way better than she did in the 90s.
Thank you. Even the 80s. I do get a little swelling, so you should be prepared for
That's right.
not
You
downtime. You can use makeup. A little bit of swelling, but I think it's partly because I have such sensitive skin that I have that reaction to it. So I swell, especially under my eyes.
I agree.
But that goes away in a couple of days. You can ice it and do, you know, sleep with your head a little propped up.
That's right.
But I think it's a great treatment, and wearing sunscreen after that and always
wearing
is very
sunscreen
important.
and is a very important thing for people with rosacea. And that brings me back to something, last time I was on, we were talking about sunscreens, and you asked a question after about physical.
Yeah.
And physical sunscreen means we're not using chemicals to absorb the sun, we're using titanium and zinc oxides to reflect the sun away. And that's what people with rosacea should be using.
Okay.
Titanium and zinc oxide physical sunscreens.
And there's no downside to using those chemicals because they're natural,
No,
right?
not at all, either way.
Yep.
What products have those?
Well, there are several that do. Anything that says physical sunscreen, but you want UVA, UVB protection, so you want broad spectrum.
Yep.
And as long as you have at least a 10% zinc or titanium, it's going to be broad spectrum.
Yeah.
So using those, especially for rosacea, is very important. It doesn't make any difference what kind of sunscreen you're using if your skin's not sensitive.
Yep.
Either the chemical or the physical work very, very well. And as long as you tolerate it, just make sure you're using a good sunscreen with broad spectrum
I just got a really good primer from you that has a tint to it and SPF in it. And
that's from Color Science. That's the Even Up.
I love it.
And it
I
has
highly recommend
SPF
it.
in it.
Yep.
Right off, and it is broad spectrum.
And I don't even wear makeup over it because I think it's the coverage is so pretty on its own.
It's great.
So
and a lot of the sunscreens we have are tinted, and so you don't need makeup in the summer.
Very pretty. So here's how you can find out more. You've got a special right now on sunscreens through May, and that is that they're 15% off. You also have how do you say it?
Natura Bissé.
That's exactly what I was going to say. Products for 15% off. It's French, like me. So no, Pewaukee. That's where you can find the Wisconsin Vein Center and MediSpa on Georgetown Drive. Stop in though. The best thing is to stop in, have them look at your skin. You can go over what works for you, get some of the best products for anti-aging, and really make yourself look better than you did in the 90s, right? Or the 80s or whenever. 262-746-9088, WIMedispa.com. Thanks so much, Deb.
Thank you.
Always good to see you. Thank you.